My name is Rebecca Smith, and I am an adult nurse practitioner. I studied at MCV back when it was called MCV, but VCU Medical System. I graduated from MCV in 1998, so I've been a nurse practitioner 17 years, and I've been in cardiology. One of the things that I love about what I do is because I'm a firm believer in prevention. But oftentimes when we see patients, they've already developed the disease state. But I think it's empowering for the patient to get as much information as they can. And I always encourage, get on the internet. There's so much to see, but with control, because sometimes you can read things that are scary and don't really understand. But I think the more informed you are about your health and your disease process, the better choices that you can make moving forward. And I think as a nurse practitioner, we have a great opportunity to teach our patients. I love to sit down and get to know my patients and talk about prevention moving forward, how to take better care of yourself moving forward. Can't change the fact that you had a heart attack. You can't change the fact, unless with great effort for diabetes, some people can turn that around and go off of medications with appropriate diet and weight loss and the appropriate regimen. But some of the things you can't change that happen to you as far as your family history. You've got high blood pressure, family history of high blood pressure, you've got it. Family history of heart disease, you're at a higher risk of developing it. You can greatly reduce the risk of you getting it, though, by how you live your life and your lifestyle, by eating healthfully, exercising, taking good care of yourself, knowing your blood pressure, knowing your cholesterol, knowing your blood sugar. There are so many things that you can do to prevent heart disease and the complications that arise from it by just taking better care of yourself and taking an interest in your own health. We're here to guide you, but I always tell my patients, the hard work is for you to go home and live this lifestyle that we're talking about. And it's not easy, and I don't ever sit back and say it is. Personally, have a family history of heart disease, and my dad died young. And I take it very seriously, and I tell my patients that too, that story, because I think it's important for them to know that, we're dealing with some of the same things they are. So I think that's important for them to know too. It's little personal things that help them realize that this is an important subject to you, and it's why you do what you do.